So this group of medication, right, the incretins, was originally developed for the management of type 2 diabetes. And when these meds were then used, some of the cardiologists then realized, my gosh, my post-heart attack patients actually do better if they're also on a GLP versus the other guys that are on standard of care and are not on a GLP, purely because these drugs reduce cardiovascular disease, right? And then the nephrologist then discovered, oh my word, if I use these meds in my patients that have renal failure, for example, these medications are able to improve renal dysfunction to some extent. They are renal protective. They protect your kidneys. There's studies that have shown that. And so they then got onto the bandwagon. And so what I'm trying to get at is that these drugs were originally developed for the management of type 2 diabetes. But in the studies, it was then also seen these drugs also help people to lose weight. These drugs also are protective for the kidneys. These drugs are also cardioprotective. So no, they're not just indicated for type 2 diabetes, they're also indicated for chronic weight management.
Okay. All right. That makes sense. Right. One big concern, and I think a lot of people that are going through this will be asking and, can't wait to get the answer to it. Once you administer the medical part of it, to lose weight, there's something that's left that needs to be taken care of, loose skin. So how can someone reduce the risk of loose skin during or even after medical weight loss?
So it really depends on the rates of the weight loss and also the areas where the loose skin is. So, for example, if the loose skin is on the body, that's something that we would refer to the plastic surgeons, right? They're the experts in treating that. If the person has laxity in the face, that's where also your plastic surgeons come in, but also your aesthetics doctors, because there are many non-invasive or minimally invasive things that can be used to treat loose skin. So Ozempic face, right? Your face falls, you get saggy jowls. So what one can then do is to inject biostimulators into the skin, just underneath the skin. And these are products that increase the amount of collagen and the amount of elastin that your body produces. That over time, especially after about 2 to 3 months, then tightens the skin and causes a little bit of lift in the face. But the other thing is it improves the thickness of the skin. It also improves what we call radiance in the skin. There's actually a mathematical formula for measuring radiance. And that's the whole term that we